I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go through some treatments if you have Achilles tendinitis. Achilles tendinitis is generally just pain in the back of your leg right there where the Achilles tendon is. It's that long, thin tendon that comes down and attaches on the base of your foot. A lot of times you'll feel this going up steps, you'll feel this walking. It can be very, very painful. The exercises we're going to go through today are not meant to cause any pain, so if you feel pain while you're doing them, either gently back off of them or stop them altogether and consult your medical professional. The first stretch we're going to do is we're going to do a gastroc stretch. So find a stair, a curb, anything elevated, and go ahead and step up on. You're going to put the leg that's injured back. You want to keep the toes on the step, and you're just going to keep the back knee straight, and you're going to drop that heel off the step. You want to hold that 30 seconds, and you're going to do about 6 of those. Now, depending on how much pain you're in, you may not be able to drop it down very far, and that's okay. Go down as far as you can until you feel a nice gentle stretch, and then go ahead and come back up. You can do this as many times throughout the day as you want. For the next stretch, you're going to go back into the same position that you just were, except this time, instead of keeping that back knee straight, you're actually going to bend the knee. So you're going to feel a little bit different stretch, still in the same area, still focusing on the Achilles, but you're going to do that nice, easy stretch, and you're going to get that stretch in the back. Again, drop that heel down as far as you feel comfortable. You don't want to drop it down too much and put yourself in pain. You just want to drop it down to the point where you feel a gentle stretch. The next exercise we're going to do is a hamstring stretch. We're going to do a hamstring stretch in standing. You can do this in sitting. The one thing that you want to make sure that you do with a hamstring stretch is keep your back straight. So many times you see people just bending over at their back or trying to touch their chest to their leg. That's just getting a stretch in your back. It's not stretching your hamstrings. So you want to make sure that whether you're doing the sitting, standing, with a strap, laying down, that you are focusing on keeping that back nice and straight. So you're going to prop your heel up on the step. You're going to pull your toes towards your nose. You want to make sure that that foot stays nice and flexed. If you lose that position, you're going to lose a lot of the stretch on the hamstring. And you're going to stand up nice and straight, and you're going to bend at the hips. So you want to hinge right at the hips. Again, you don't want to collapse your back. You want to bend forward at the hips, almost sticking your butt out. You're going to feel a stretch in through the back of the leg, in through the back of the knee, in through the Achilles. The Achilles comes up and it's responsible for muscles that attach at the back of the knee, which is where the hamstring also attaches. So you want to make sure that you're concentrating on treating that whole back of the leg when you're dealing with Achilles tendinitis. Otherwise, you're just treating the symptoms and you're not really treating a lot of the causes. So you want to focus on more than just that specific tendon. The next exercise that we're going to show you is with what we have here at the clinic called a beastie ball. You can do this with a golf ball. You can do this with a lacrosse ball. You can do this with your hands. The idea is to get the massage into the back of the leg, into the back of the calf, into the back of the knee, and loosen up some of that area. So you want to find a spot, and you're going to just place the ball underneath your leg. You're going to roll back and forth, nice and easy, okay? And you just want to do this for about 5 minutes. If you find a tender spot, you're going to hold it on there, nice and easy, 5-10 seconds, and then move off. And then you're going to keep doing that, okay? You can do this 2 or 3 times a day. You may get a little bit of bruising depending on the apparatus that you're using, but this is going to help break up some of that tissue that's causing that tightness in the Achilles. If you have any questions, give us a call at 215-997-9898 or visit us on the web at www.totalperformancept.com.